Welcome back, Winers. My name is Amanda Lopez, president here at Transform Consulting Group, and I'm so excited to be here because we have a special guest joining us today. We are going to be talking about Community Indicators Dashboard. But first, let my guest introduce herself. Alison, please tell our listeners who you are, what your role's been in the nonprofit sector, and what you're doing now.
Sure. Hi, I am Alison Gerardot. I'm the Chief Impact Officer at the Community Foundation of Greater Fort Wayne in Indiana. I have been in my role at the foundation for 8.5 years. Wow. Before that, I've worked in the nonprofit sector my whole career. I like to say public sector. I started off in social work right out of college. My degree is in English, which has nothing to do with social work. But, when you're done with college and you're just looking for a job.
Yeah.
So I ended up doing social work for 5 years. I worked at a really small arts nonprofit for 5 years. I was then recruited to work for the city government as a contractor on our riverfront redevelopment project.
Yeah,
so I did
great.
A lot of placemaking, and then I found my way to the Community Foundation after that. So sort of all of those things have led up to me being where I am and helping inform the work that I do now.
That's wonderful, Alison. I love to hear some of that about your background. I didn't know that you worked with the city and a part of that development. So you definitely have seen a lot of different sides of the table, being in government, being in direct service, and now being in philanthropy.
Yeah.
So it really brings a broad lens to the table.
Absolutely.
Well, good. Well, I'm so excited to talk about the episode and talk a little bit about the partnership and how we've been working together and supporting the work of the Community Foundation. But before I do, let's introduce our listeners to a really interesting wine that we've selected. So we have a non-alcoholic wine, which non-alcoholic wines are really good.
Yeah.
They taste so similar.
They've made their way.
There's so many options. So we have one here, and it is called Frey. I'm guessing it's a Sauv Blanc from a California vineyard. So let's give it a taste.
Okay.
Cheers.
Cheers.
Wow. It tastes so much like wine.
Oh, that's good.
It does not, I always think of non-alcoholic being like a sweet juice.
Yeah.
But it is not at all.
No, that's good.
It's like a really good, refreshing, sit on your patio.
Yeah, it's light. It's a little fruity, but not sweet, not intense, like a rosé or something.
Yeah, it is like a good fruity, grape-ish taste. Well, I would give that a thumbs up.
Yeah, that's good.
Wonderful.
Great.
Okay, well, as I talked about, we are really here to talk about a community dashboard.
Yeah,
that Community Foundation, Greater Fort Wayne, started on a few years ago. So, first maybe, Alison, introduce the concept of where did this idea come from? Why did you see a need and an opportunity to create a dashboard that wasn't just going to be internal for the Community Foundation, but really would be something public facing?
Yeah, so the precursor to the dashboard was the establishment of the Community Foundation's Let's Rise Vision Plan, which we created in 2019 with our board as sort of initially a strategic plan that turned into a vision plan. There's a whole story behind that, but it includes 5 pillars of well-being modeled after the Gallup Well-Being Index, which Gallup used to do for 186 cities across the U.S. They don't do it anymore. Fort Wayne was one of those cities. And so our vision plan was based around that. So these sort of 5 pillars of well-being are connected community. So how are we feeling in our community? How connected are we to each other? Loved and supported in our community. Inspiring places, which is about the physical places that we have in our communities. Everyone's economy, how are we able to live our lives financially, economically in our communities? Lifelong learning is around, obviously, that's really self-explanatory. Education, cradle to grave. And then healthy mind and body, all the ways that our well-being is surrounded by our physical and our mental health. So as we devised strategies underneath those 5 pillars, we also felt we are very data driven and we want to know what does the data say to help inform how we move forward. There's a lot of feelings that can be had in communities, we feel like something's happening, but that might not necessarily be the case. And sometimes it is. Oftentimes there's very few surprises in the data, right? Usually just what you're feeling.
Affirms.
Right.
what we know.
But
or think.
there can be surprises,
Yes.
and it's really important to be able to track that over time. And so we really felt strongly about creating a community-wide dashboard that would encompass these 5 pillars, because they're so broad, right? It can encompass a lot of things under these 5 pillars, and start collecting community data so that we can know, not only inform us how we can best move forward, but how the community understands where we are and how we're moving forward as a community, and also how nonprofits might be able to use that data in their own, grant reporting and grant applications and things like that as well. So that was what spurred the community dashboard.
I love that. And I think you touched on a lot there. This one, it really came out of a vision plan, but you really took it externally. And I do think whether you're a community foundation, or a nonprofit providing direct service, so often we spend so much time creating these beautiful plans and then don't really know how to measure and track that.
Exactly.
To see what the progress is. So you just took that a step further to say, hey, this is a community plan for all of us. And let's put it out there so we can all, one, maybe be held accountable.
Yeah.
Celebrate the wins, though, too, to see we are making progress on this well-being index and our community is getting better, or be able to hone in and identify areas where we're not doing well. Maybe we need to pivot, whether you as a foundation and maybe your grant making priorities, or, other nonprofits in the community and how they align their services.
Yeah, absolutely.
Could all be ways about going about that. So I think we've done 3 annual updates now to the dashboard. So, it's exciting to see how it lives out there. But what's been some of the feedback that you've received from various partners in the community about the dashboard?
Yeah, I think, I would say first off, before our feedback, I would say just knowing that a dashboard is a commitment. 1 year's worth of a community dashboard basically tells you nothing. I mean, it can tell you things, but it doesn't tell you a whole lot.
No, I love that, though. And so that's a good reality set.
Year 3, right now really is where we feel like we're actually starting to get some traction. And this year we were able to pull a whole bunch of sort of historic data from, 5 years plus and bring that forward into the dashboard as well.
Yes.
So all of that combined helps tell a much more compelling story, but you have to be willing to commit long-term to this dashboard. This is not a one and done type of, okay, and now we're done with the dashboard.
Right.
So as far as how people have received the dashboard, I think it's been received pretty well. We're still trying to get the word out about the dashboard. I think it's still, I would say, a really well-kept secret, just because I don't know that it's intuitive for nonprofits to come to the community foundation page, because we are a larger city and we have a lot of resources for them to come to our website to see our dashboard and to check things out. And it only does, I would say, get updated once a year.
Right.
So I don't imagine people are visiting it every few months, frequently, just because it doesn't change once you've looked at it. But we are now starting to use it more. We just had a board retreat a few weeks ago, and we really brought it forward for our board.
I love that.
This year, to say how, as we are deciding what priorities we might want to focus on in the future, how are we using the dashboard to inform that? Or not. I mean, maybe part of it is and part of it isn't, depending on what our board wants to do. But it can be a really powerful tool. And I think just affirming for them the momentum that they are seeing in certain areas in our community affirmed, or some of the underlying stories behind the data that our different board members can tell to either support or refute some of the data that's in the dashboard.
Right.
So that's really interesting too.
Yeah, I love that. I want to go back to what you started out at the beginning of this has to be a commitment.
Yeah.
It's not just a one and done.
Yeah.
Because it is a lot of investment of time. We're pulling data that's publicly available. We haven't even talked about the survey that goes out in the community, because when we started to map out some of the indicators to track your impact of the Let's Rise vision plan, we realized that there's some gaps of the data that's available. So we had to go out and collect that data. And that's a whole lift to get any, community-wide survey data. But it does take time to see progress, right? And see what change can happen. Because that first year, you can pull in some historical data, but that's past.
Right.
And so we want to know what's happening now with the impact and the interventions, that are going on to then move forward in the future. So definitely commend, Community Foundation and investing in that and continuing to do the work and putting it out there. I'm curious whether it was most recently for your board retreat or any other conversations you've had, if there's been some data that you've seen in the dashboard that's been surprising or interesting that you've heard from people now that it is culminated in one place and, visualized.
Yeah, I think something that was affirmed, not necessarily from the nonprofit that's doing the work, but it was affirmed because they're doing the work, but I was able to correlate that to the dashboard. We have had historically one of the lowest infant mortality rates in the state in some of our zip codes in Allen County, and that actually dropped last year. It's plateaued, so we haven't gone back up, but we haven't continued to drop. But we're not at that peak that we were at a certain point in time a couple of years ago. And that is really due to, there's a nonprofit locally that's solely focusing on the infant mortality rate. And they got a very large federal grant to do very intensive case management. And those numbers, there's like direct correlation there between the numbers that we're seeing and the work that nonprofit's doing and the dollars that are being used to affect those mothers. And so that was really promising and really exciting to sort of hear her say, here's the drop we've seen. And I could say, yeah, we see that drop in the data on the dashboard. So that was affirming. I think some of our data around just education is always shocking to me, and also sort of backed up by the community survey work. So saying, educational attainment across the state of Indiana is really like higher education, I would say, is very low.
Right.
And so looking then at the survey data saying, and most people in Allen County are okay with that. Like most people don't want to go on and get further education. Like they're good with a high school diploma or a credential or some bachelor's degree attainment, but not a full degree, right? And so I always find that really fascinating.
Really interesting.
Yeah, we have these conversations locally like, why aren't these adults like taking these adult scholarships or going back to school or doing XYZ? And I'm like, y'all, I don't think that they really want to. The dashboard says that they don't really care. Now that could change maybe next year when we refresh that data. It's been a couple of years, but as of a year and a half to 2 years ago, they were good.
And I think that's a great opportunity. It's like a check-in point, right? Because you have the quote unquote professionals and the experts saying like, we need to do all these things. But then when we're able to layer in that stakeholder feedback and the community feedback, it can either say yes or no, to, what complement what those professionals are saying.
Right, exactly. And then if it contradicts that, then where else can we go? Where can we focus that there might be opportunities as opposed to just continuing to beat our head against a wall and trying to force something to happen that's not necessarily probably going to happen.
So I'm not going to like toot our own horn, but I am going to toot our own horn, at least my team's horn of like, I think the dashboard is so beautiful. And I wonder what feedback people receive about that. But what I love about your dashboard is there's a lot of use of maps that we've been able to integrate because, you're in a large county. Fort Wayne's the second largest city in the state of Indiana. And so it can be so easy to just hone in on the large city and forget that there's this larger county or go even deeper into neighborhoods. And so the beautiful thing about your dashboard is that a lot of the data is able to be mapped out. And so, different partners can hone in on cities or zip codes or school districts, and really get a deeper dive than what you might be able to get in a static report.
Yeah, absolutely. Yeah, I love all of the ways that the data has been sliced and diced in our dashboard. I think, there's a map. There has been a map and I think it's still on the current dashboard around childcare deserts and, who's really impacted by that are our rural partners, right? The people in the rural parts of the county see that much. I think there's an assumption that there's this like desert in the very urban parts of our community, and that's really not the case. It's really all of the areas surrounding the city that are huge deserts for kids. I think when we're looking at healthcare, particularly just all of the ways that the information is diced by zip code. And what was really interesting this round was seeing one of our very rural communities has the highest incidences of alcoholism and depression. And I think that took our board by surprise because, again, I think they live in this very we're in the city part of our community, and there can often be just not attention paid to the rest of our county just because often the city speaks the loudest, right? And that's what gets the most attention. And so to point out and remind folks that, yes, we continue to serve the entire county, and some of these communities in our county are really suffering more than some of the very urban core. So that's always really interesting and important stories to tell that the data tells.
Yes, absolutely. And, we were able to take, dozens of data sources and I think close to 100 indicators in this one dashboard. So you really are able to pull in a lot of information, not only for the Community Foundation, but the community at large and like a one-stop shop, so to speak.
Absolutely.
Organized around those 5 pillars that most see in common.
Yeah, absolutely.
I love that. Are there any other, wins or takeaways that you've heard from partners of saying, thanks, Alison or the Community Foundation for putting up this dashboard. We've done this, or, we've done this.
We haven't too much. We had hoped for more. And this round, we actually offered a section for if people click on it to be able to submit a story if they've used the information to help them. I think it's interesting as we kind of figure out how to tell the story of the dashboard more, how we might integrate that more into our grant making, where in questions on some of our applications, where might you see yourself in our community dashboard or different things. We haven't added that yet. So if my team's listening, don't freak out.
Don't freak out. I'm not putting it out there yet. Just, ideas by Alison.
Yes, exactly. But I think those are ways. There are some other ways we could incorporate the dashboard more sort of in all of the things that we're doing, which is what ultimately what we want to get to.
Yeah. Well, and I don't think you're alone. Like many of our clients, when they're creating a dashboard or even if it's like a data report, it is like the heavy lift to get it all there, but then there's this whole dissemination. Yeah. And like you said, it just takes time for people to be thinking of the Community Foundation as like a go-to source for data. But we're seeing more and more of that being a trend. So I think as the word gets out there, more nonprofits are going to look to you to see you as like that go-to source where you do have information, and they'll see the Let's Rise dashboard as an asset for them in their community.
I hope so. Yeah.
Well, thanks. I know we could talk forever about the dashboard, and we will definitely link the dashboard in our show notes to be able to share with the listeners and some tips that we have about creating community indicator dashboards. But we've covered a lot of ground, Alison. What would be like one takeaway, maybe if there's a foundation out there who's thinking about getting started on a community dashboard? What would you advise them to do?
Yeah, we've had a number of community foundations reach out to us, and then by way, I just forward them on to you to say, we did not do this on our own, but which is really great. I would just encourage community foundations to make sure that they have a why behind why they're creating this dashboard. I think whether that's supporting their own strategic plan or strategies or for community use, but be really clear on what that why is before they commit, because it is such a long-term commitment, and making sure that there's buy-in from, everyone throughout all levels of the organization bought into the commitment that a dashboard takes.
Yes.
Because it I think where it's going to get really good is like year 5, right? Like we're not even there. We're in year 3. It's not even going to get really good until we get further along in it. And so to make sure that there's that commitment and buy-in to supporting the dashboard long-term, and then finding great partners like TCG, right? Because especially for a medium to small shop community foundation, we don't have a lot of internal support to be able to continue doing the dashboard year over year internally on our own. And so being able to have a partner is really invaluable. So
great.
Thanks.
Well, thanks. Well, I'm sure this will be a hot topic for many of our listeners, because I do think it's just a buzzword out there. So a lot of good thoughts. I love that. Always start with your why.
Yeah.
Right.
Absolutely.
Well, thank you, Alison, for being on our podcast. Thanks, listeners, for joining us. Like I mentioned, I'll link all of these items in the show notes. If you haven't yet, sign up for our newsletter on transformconsultinggroup.com. We send it out once a month, and we don't spam you, but you'll hear great stories like community dashboards and other tips that are coming out that we could share. And then definitely encourage you to follow us on social media and follow us and subscribe to the podcast channel. We're across all the main podcast apps that you can listen to. Whine About Data. Well, Alison, let's cheers one last time.
Okay.
Thanks for doing great work in Northeast Indiana.
Thank you. Thanks for having me.
Cheers, listeners.
Cheers.